So, how do you find the right patient-reported outcome measure for your patients? Well, first of all, I'd ask your patient what matters to them. And then, if you want to find some good patient-reported outcome measures that are valid and reliable, I would recommend Google searching. Especially Google Scholar will show up articles, and you can read articles on your topic of interest that you've identified from your patient, right? I also found this database, which I thought was pretty cool. One of my postdocs showed me this one, and I thought it was quite a neat one. So it's a rehabilitation database, but it helps you find patient-reported outcome measures that best suit particular patients. Keep in mind that it is a rehabilitation measures database. It was put together by Shirley Ryan Ability Lab, which is a rehabilitation institute in Chicago. But they've got quite a cool online library of a whole lot of various measures that you can use in practice, tells you a bit about them and whether they're reliable or valid or not. And there was over 500 measures on there. It's not exhaustive. There are others out there, and there are others that are not rehabilitation measures per se. It gives you a lot of options, and it would be a cool tool to check out. I'd highly recommend having a little play around and see what you can find. But it's not all about pain. So there's many patient-reported outcome measures that look at other aspects of health as well. So here's an example of one called EQ5D, which is a measure of self-perceived measure of health created by the group Eurocol, which is an international, multilingual, multidisciplinary network of researchers from 7 different research centres in Finland, the Netherlands, Norway, Sweden, and the UK. So this EQ5D, it's a generic measure of health status. You can see it's very quick and simple to tick and fill in. And this self-perceived health measure is a cool way of just keeping an eye on your patients and how are they doing. So for the EQ5D, you've got 3 options. So in this version that you can see on my slide here, this is the EQ5D-3L for 3 levels. So it's 5 key domains, hence 5D, and 3 levels that you can tick. So I have no problems, I have some problems, and I have lots of problems, right? That's the 3 levels. So the 5 domains it looks at is mobility, self-care, usual activities, pain and discomfort, and anxiety and depression. So until 2005, respondents could only select from these 3 different options, hence -3L. But since then, there's now a 5D5L, and there's even a 5DY. The 5D5L is that there's 5 options to choose from, so you've got a little bit more sensitivity to be able to pick up on improvements. The less options you have, you fall into 1 of 3 categories. If you fall into 1 of 5 categories, you've got a little bit more room to improve or get worse. So it's a little bit more sensitive to changes. And then you've got this EQ, just the EQ, which is a visual analog scale, a one-off visual analog scale like a thermometer, saying from 0, worst imaginable possible health, to 100, the best possible imaginable health state, where you can tick off a one-off tick for where you feel your health currently is at. And these can be quite useful, again, to track in patients over time. I would recommend the EQ5D-5 levels, and as well as just this EQ one-off thermometer. And together, they give a really good indication of where does your patient themselves, where do they rate their own health? And that's a good thing to track over time. And this is super, super easy, right? If you've got 1, 2, 3, 4, 5 things that you're choosing 1 of 5 levels on, and then a 1 out of 100 score for yourself. Where do you feel your health is at? Excellent, excellent thing to track over time. Because you could just write it down as EQ 75 on today and EQ 45 a month later. Shit, what happened? What happened in those couple of months? Oh, they had a big car accident. And it keeps you track visually where your patient is at, where they rate themselves. And then there's other types of problems as well. So for example, this one is a patient experience satisfaction questionnaire, the VSQ9. It's a visit-specific satisfaction instrument. So it's adapted by the American Medical Group Association, and it's a visit rating questionnaire. So you can specifically ask patients to tick from poor, fair, good, very good, or excellent. And they can tick this for how long did you have to wait to get an appointment, what was the convenience of the location of their office for them, getting through to the office on the phone, length of waiting in the office, the time spent with the healthcare provider, with you. the explanations that were given to you, the technical skills that you felt that your physician provided for you, the personal manner that the person treated you with courtesy, respect, sensitivity, and the overall visit. So you can see that this would be an excellent way of measuring in groups of your patients to see how are you doing on these different levels of your care that you provide. If you're in a multi-practice, you can rate each of the individual chiropractors this way that are working for you or with you to see how are you guys doing individually, and are you all up to scratch, or should you maybe do some more seminars? Do you need to train your front desk staff to answer the phone quicker, or do you need to implement better procedures in your office so that your patients aren't waiting so long for their visits? And that kind of thing is a good overall visit-specific satisfaction questionnaire. Then I wanted to share with you this MyMOP questionnaire because I think that's pretty cool too. This is a Measure Yourself Medical Outcome Profile. So it was created in 1996 to provide an objective outcome measure for a therapist to monitor their client's progress on specific symptoms that mattered to the patient. So it was revised in 99 to also include medication. It's talking usually about symptoms. And so if people were mentioning pain and then pain scores may not be changing, and you might be thinking, well, what am I doing wrong? But the pain scores may not be changing, but they're suddenly not taking any pain medication. Well, that's a fantastic outcome. So that's why there's a MyMOP 2. So I would not recommend the MyMOP. I'd always recommend using the MyMOP 2. And there's one that you can fill in for the initial consultation, and then you can have follow-up visits. The information that you can provide is for one or two symptoms. So the patient will tell you, well, I'm here to see you because I'm really concerned about this right leg weakness and this low back pain. So there would be two symptoms, and then the patient can grade them from 0 to 6. So 0 being as good as it can be and 6 being as bad as it possibly could be. So they can rate that right leg weakness separately from the low back pain or numbness and tingling, whatever their symptom is, or it could be their mental health, or it could be crying time in their baby, whatever it is that is important to them, you can use the MyMOP 2. And then you can monitor it from the first visit and to follow-up visits. It's really important that these questionnaires are filled in by the patients and shouldn't be influenced by the practitioner themselves. What's considered a minimally clinically important change? That is something I haven't talked about yet. But that's a very important thing to consider in these patient-reported outcome measures, in these PROMs. Because this minimally clinically important change is, again, what many studies have looked at this, what actually matters to patients. So again, this isn't just something that we've pulled out of our hats or heads, but this has been studied and patients have been asked. And what's considered minimally clinically important on the MyMOP 2 is a change between 0.5 and 1 points. Right? So any change greater than 1 is definitely considered clinically significant. It actually genuinely matters to people if you can change with more than 1 point. So if you've gone from a 2 to a 3 or a 4, that is clinically significant. That matters to them. That's what this means. So again, this MyMOP 2 has been shown to be valid. It's validated. It's highly sensitive to outcome measures. So it's one I'd really highly recommend that you look into using with your patients. So this is what they look like. This one on your left here is that the MyMOP 2, the initial one, the pre one that you would use on the first visit, and then you've got the MyMOP 2 follow-up. So that's those over time you can follow it up and see how they're improving. So I want to go on now and talk a little bit about quality of life patient-reported outcome measures that you can use as well. It's another thing I think is awesome for chiro patients. But first of all, just pause again, test yourself, make sure you're picking up on the key concepts from this lecture.